Why does canine distemper cause hardpad disease in dogs? Imagine your dog walking around happily, then suddenly their paw pads start thickening and hardening. That's what happens with hardpad disease caused by distemper. This condition is a sign that the virus has affected the skin on the paws and nose. But how does a virus lead to such thick, painful pads? Let's find out. Canine distemper virus is a single-stranded RNA virus from the Paramyxoviridae family. It first infects the lymphatic tissue in the respiratory tract, causing the initial symptoms. From there, it enters the bloodstream and spreads throughout the body. The virus then targets specific skin cells called keratinocytes, especially those in the outer layer of the skin on the paw pads and nose. When the virus infects these keratinocytes, it disrupts normal keratin production. Keratin is a protein that makes the skin tough and protective. The infected cells produce too much keratin and become abnormal. This leads to thickening and hardening of the skin, a condition called hyperkeratosis. The skin on the paw pads and nose becomes rough, enlarged, and painful. The virus also causes irregular thickening of the prickle cell layer, called acanthosis, and makes the reedy ridges or the skin's ridges thicker. Sometimes, the virus infects other skin structures like sweat glands, blood vessel linings, and connective tissue cells. This causes inflammation and further tissue damage. Dogs that survive the initial phase of distemper often develop hardpad disease later. During the early infection, dogs experience a fever that comes and goes. After the fever subsides, if the dog survives, the virus can continue affecting the skin tissues. This results in the thickened pads and nose that are characteristic of hardpad disease. The thickened pads can cause discomfort, making it hard for dogs to walk or even stand comfortably. This is why distemper is sometimes called hardpad disease. Even after the virus is controlled, the damage to the skin remains, leaving lasting changes. Understanding this process shows why vaccination is so important. The distemper vaccine is very effective at preventing infection. Vaccinated dogs rarely develop distemper or its skin complications. For dogs that do get infected, early treatment can help, but some effects like hardpads may stay. Recognizing the signs early and vaccinating your dog helps keep them healthy and comfortable.